Here we go. Hi, everyone. Welcome. Looking forward to spending this hour together. I'm really excited about this CIN webinar. It's on developing a community-based and integrated model with peer professionals. During our hour together today, you'll get a chance to hear from Painted Brain, which is a statewide peer-led community-based behavioral health organization. And they'll get a chance to share about their integrated community approach and training centered, powered by peers. You'll also get a chance to hear about directly from a peer support specialist and about some of the challenges that many peer support specialists face and navigate in this work. So really excited for this hour. I do encourage folks to put questions in the chat as we go through, and we'll have ample time at the end for that as well. So my name is Marie Hubbard. I am part of the team that leads the California Improvement Network. You've probably also heard the term CIN. CIN is a learning and action community that really advances equitable healthcare experiences and outcomes in California, and we do that through cross-sector connections, learning, and the spread of good ideas. CIN is a program of the California Healthcare Foundation, and it's managed by Health Force Center at UCSF. Once we get started, I'll pop those links into the chat so you can check out our organizations. So the essence of CIN is really built on co-design. And so we really want and hope that all of you stick on through this whole hour, and at the end, provide your live feedback and on this content and future content, really because we want to be able to be responsive to your needs and be able to support and provide relevant content to your organizations within the healthcare ecosystem across California. So it truly is only a minute, and we want you to stay on also to hear this great work by Painted Brain. So with that, I'm really excited to introduce our speakers for today. So we have Rachel Chambers, who's the Executive Director at Painted Brain. And we also have Bella Pritzkat, who's a Peer Workforce Development Coordinator at Painted Brain. So I'm going to stop sharing my screen and let them share theirs so we can get started.
Welcome. Thanks for having us, everybody. So today, Rachel, our founder and executive director, and myself, we're going to be discussing developing a community-based and integrated care model with peer professionals. You can go for it, Rachel.
All right, and some of the key points that we'll discuss is an overview of Painted Brain, so individuals can be introduced to a peer-run organization and the great work that we do in our capacity as a peer-run organizations across our great state. And then we'll be able to talk about our integrated whole care model and our approach to whole person care, the peer experience led by Bella, and the challenges to address and our call to action. And so we're really excited to share our story. As you know, or may not know, Painted Brain is a peer-run organization. So many of us have lived mental health experience or in substance use or trauma. We create lasting community-based solutions to mental health challenges and the impact of social injustice through arts, advocacy, and enterprise. So really breaking that down is that as the needs of our clients and the population and the most vulnerable individuals that we serve, as they evolve or we understand them deeply, we believe that social justice plays a piece in that and in ensuring that people can have a whole and healthy life, and that we utilize arts, advocacy, and enterprise. And we'll talk a little bit more about that in our approach to really helping individuals who are the most vulnerable Californians in our great state. As I noted, we're peer-led, culturally rooted. We are really grounded in culture. I think that's one of the biggest strengths. I think we literally were just talking today about a cultural specific approach to how we do our life skills groups. And really with trauma informed, many of us have been through trauma. So we know best on how it feels like to, deal with trauma and how to get the supports. We also are a Cal Mesa vendor for the Medi-Cal Peer Support Specialist certification. That's a really big accomplishment of ours. We get to train our great state of California individuals with lived experience and allow them to draw down Medi-Cal. Bella will talk a little bit more about that. And then we also advocate with other amazing partners like Cal Voices on statewide behavioral health legislation. And we, as a community-based organization, we've only been around since 2016, almost 10 years. But as a project, we've been around for 20 years, delivering community mental health service throughout Los Angeles and through our great state of California. And those are our founders and our board. We are, like many of us, are individuals with lived mental health and substance use recovery experience, even on our team and on our board is represented by BIPOC and women-led is really important. I believe that the other co-founders really made a way for individuals like me and other people who are different to stand in leadership, and our board and our great leaders stand behind that. A little just glance about our history. We won't go too deep. Me and Bella said we weren't going to go too deep because it's not all about us. But we started as a peer-run grassroots model with a magazine. We evolved in 2010s with me, Dave, and Eli. Eli being in technology and Dave being a licensed social worker and me being a developer and grant writer. It was a perfect match of people who had mental illness but saw the beauty and the amazing skills that individuals in either locked settings and in other settings that they could work, they could thrive, and they can have agency over capacity of their life. And that's really how the company started, with that kind of commitment. 2016, we incorporated. We opened our community center, a new community center, our first one in 2017, but we're in a new community center right now, located in Koreatown in Los Angeles. We will be opening another office in a week or so in Contra Costa, and hope to open a peer respite in Oakland, California in the next year. So we're excited to expand, and we'll talk a little bit more about that as well. Just a little brief overview of our services, just showing you the power of what people with lived mental health and justice involved experience can do in running an agency. Our hallmark is peer support. So we are led by peers. We provide individuals with lived experience opportunities to work and to practice. So we provide workforce development training for the peer support specialists. We provide clinical mental health services. Advocacy work. We're on a number of statewide advocacy projects, which we'll talk a little bit more about. But we really are not just doing the work. We're actually in the Senate, in the Assembly, telling real time of what's going on relative to healthcare, relative to our most vulnerable clients. We provide peer support services. We've just gotten into enhanced care management, which I'll talk a lot more about, because I think that there's opportunities and challenges for small CBOs and peer-run organizations like us, but great opportunities to do the work and enhance care management and provide our provision of service. We also provide the community health worker benefit. We integrate arts and community workshops. We have art exhibitions and community events, and we have some small funding for that. And we have a social enterprise. Since our beginning, I've always believed in workforce development and art. So we just launched again a clothing line. We got small seed money from UCLA to do that. And we have a screen press, a 3D printer here. So we really do integrate arts. And that's where you see, like, when you really want people to get engaged in services, we found that one of the secret sauce is art and engagement. And just some of our impact. Since 2024, we've provided, without any government, Medi-Cal contracts. So this is all from grants and scraping pennies and change. We've served 739 individuals in peer services. Through our peer support specialist training, we've trained a little bit more than 360 individuals. We've done 168 life skills and building services. We've trained over, I think, more than 75 county employees and psychiatric advance directives. And now we're training hospital staff and law enforcement. So this number is going to hike up relative to advanced directives. And our digital health literacy, we believe that equity is education also in healthcare with digital literacy. We believe that individuals, for them to fully be able to engage in service, that they have to have literacy in how to utilize those tools. And so those are just some quotes. We're going to get some more quotes, but I think that the biggest thing, and a quote that's not on here, but was a story that we just met with the psychiatric social worker at the UCLA psychiatric unit, and we do our groups there. And she just noted that those groups have changed just the whole dynamic. Our peer-run groups have just changed the whole dynamic and engagement of recipients in the psychiatric units. And so we just our arts and engagement and our arts and empathy work, I believe that, and we believe that we can transform not just community-based settings, but in locked settings and support people and have an agency over as much as possible in their life. Okay, the model. We have a model. So this is, I think, part of the reasons why we want to be here to let you know, because our approach to service in the last 20 years and what we saw is, and we've called it the painted path recovery model. We integrate peer support, arts, enterprise, and advocacy to build holistic trauma-informed services. We really do believe, and we actually have some county contracts right now to really empower individuals that are utilizing Medi-Cal services to be advocates, to go and speak in public about, their lived experience. So we believe our model uplifts the voice of lived experience with licensed care teams, providing culturally relevant support and promoting personal agency. Like we noted, agency is important, and giving folks the tools to have agency over as much as possible in their life is our goal. We believe that recovery is possible for everyone, and when it's supported in community. And I should have started off this webinar by saying that, and we'll talk about it later in the slide, but I hope the premise here of why everyone is here is that they believe that recovery is possible. If you're in treatment, you're in a hospital right now, you're doing some work, I hope that you believe, like us, that the services work. So this conversation is rooted in us, in that belief that recovery is possible, and that we believe that people, once they recover, to some extent, can work and thrive or live full lives. And so our model is grounded in just that lived experience, can support that support from those who've been there. Like when my last psychiatric hospitalization, it was peer support individuals. I cannot get in contact with and I'm not knocking social workers, but I couldn't get in contact with my social worker, couldn't get in contact with my psychiatrist. It was the Tristans that's on this call right now, or the Bettinas that answered my call, or the Vanessa Ramos that said that when I was losing my mind about what the medications and the symptoms and embarrassed, that I could call them in the middle of the night and be like, is this normal? These things, that's the lived experience, and it's applied practice. So we're not just using the lived experience, we're actually training individuals. We're collaborating with treatment teams, with clinical teams since our inception, and non-clinical staff to do this work. And we hope to do it better in Medi-Cal. We also use the creative expressions, like telling your story, arts for healing. Like I got indoctrinated in arts as a medium by my other co-founder, because he was like, Rachel, art is the language that it didn't even got a language. You don't even got to say nothing. It's the universal language. You can get a piece of paper in a setting where no one's talking, everyone's disengaged. Put a piece of paper and a pencil, draw something, just have them draw something. You can start there. And creative expression is what we believe is the key. And empowerment, empowering individuals, communities to make change, to be the change that they want to see. That is important. We want people, and we'll talk about psychiatric advance directives. When I talk to my friends who are psychiatrists and social workers, they're like, we don't know best for the clients. And if any of them say that they do, then they're not telling the truth. They want to hear from us, like what we know, and then we can have a collaborative approach, right? That's the coordinated care that we at Painted Brain envision and see, like that, the care coordination and an enterprise. For me, some thriving, meaningful, having meaning in life, in community. For me, it's volunteering, it's getting training, it's employment. When you employ a household, employ a person, it changed my life as somebody with a mental illness when I got my first job and was able just to have additional things, as somebody that was, low income. So for me, I envision a world where everyone, no matter where their mental health function is, that they have some sense of agency to give back to the community, to have purpose, whether it be employment, volunteering, doing something. And Painted Brain wants to help you explore that. So just some our great friends at Cal Voices and us have done some good work around and Karis Myrick and other people and MHA and doing the pulling the research, because peer work, a lot of other states, and sometimes we got to make Californians jealous. As a state commissioner, I am a commissioner. I didn't tell y'all that. Over our now it's Behavioral Health Commission. It was the Mental Health Oversight and Accountability Commission before Prop 1. So I'm tasked with with as the consumer the consumer role and seat, and I was appointed by Gavin Newsom. And it's my job to highlight and uplift our work in California and to get the best services for California. And I believe sometimes we gotta let other people know what they're doing in other states. Like other states have got it. Other states like Minnesota, in 2024, Blue Shield, Blue Cross Blue Shield of Minnesota launched a new peer specialist benefit available for commercial and Medicare Advantage members experiencing recovery and mental health challenges. And other states have this benefit as well. The evidence-based resulting outcomes with increased access to free recovery-oriented non-clinical support, so you can get faster access to individuals, right, that are trained with the 80-hour training, have to take a state certification. So these are not just individuals that are just coming out there, that they can provide recovery-oriented support. Also, this improved personal outcomes. Peer services reduces depression, substance use, hospitalization readmissions, while boosting community connectedness and overall life satisfaction. Us as peers, we're encouraging individuals to go out into communities. I always tell people, you break your arm, you don't want to heal at the hospital. You want to heal in community. So that's what we at peers believe. We believe as soon as you can, when you're ready, let's get you in that community. Let's get you connected to your church, to your LGBTQ center, to your social security office. Let's get you connected to the park and volunteering. And that's what peer support really does. And the expanded coverage and broader system change. Blue Cross anticipates that health systems will be on board with more peer support specialists and set a new standard for health plan coverage. And I think that that's just beautiful, that a health plan is really seeing the value and believes that other health plans will come on board. And I believe that this is possible. I think that there's opportunities. Peer support specialists currently are only in county behavioral health plans right now. And so I think it's an opportunity for us to work and to advocate for us to be in plans, in the commercial plans. And then also just some more of the data real quick. I know we only have 30 minutes and that's our hour, but I'll be faster. That we'll speed through this, but there's been California studies or right now a 2019 study that found that youth peer support reduced racial disparities and utilization of outpatient services. Some of the data showed that youth receiving peer support specialists attended significantly more outpatient settings. And then they have the numbers for LA County and in San Diego. And then the peers in the program, the Black and Latinx individuals attended at the same number of outpatient visits as white non-Latinx. So that's just showing it's decreasing disparities of usage. And we do that because we look just like, if you look like the people and you sound like the people that's where serving you, we are hope. We are encouraging people. We believe in getting services. Yeah, and then so we want to show you that there's data, and we have more data if you want to hear it, but we'll go to the next slide. And that's with enhanced care management. Okay, as a peer and small organization, a lot of the health plans did not know us. And so it was really hard. It took a long time, and we took all of our own money. We do not have the path-cited grant. We don't have anything. We spent our cash reserves and slowly have now integrated and got all the certifications, did all the everything, got our PAVE number, did it all, credentialing, everything on our own, and eventually got TA help, but started all on our own, but no money. And now we do ECM. And I think our niche, particularly, is because of our peer model. We get to integrate peers on our lead care management teams. And I think that the biggest thing, I don't want to like bore everyone alone. A lot of people know what ECM is, but peers have been working with high utilizers since our inception. Like, so it was really challenging, but a good opportunity once we got in front of the plans or people that would listen and be like, these are our folks. Like, we know them, we love them. We've been at the courts, we've been serving, we've been at the justice. These are our folks. We've been coordinating care since the beginning. So ECM is an opportunity as the system with Prop 1 moves to a Medi-Cal model. We hope that we can move into this commercial. Well, we will. We don't believe failure is an option. We'll move into this commercial model of utilizing peers with lived experience to build trust and build gaps in services and reduce stigma and offer support to vulnerable ECM populations. We'll work on integrated teams as we've been doing since our inception. And the cool thing that people should know, but peers can be lead care managers along licensed providers to support in case management and work on multidisciplinary teams. And we know that we will improve client engagement and recovery, and all this while building Medi-Cal. So we're excited to get into this game. And I know a lot of the folks know about ECM, so we can go to the next slide. We want to uplift that there is a significantly high number, significant, I want to say it again, peers that are already working as community health workers. All of our peers, because don't have a benefit in ECM or in any of these managed care plans, we have to work as community health workers, which we have been since our inception. We are the same population. So we are working to help utilize our peers and the community health worker support with more of a health focus and integrating and supporting clients with navigating health systems, accessing resources, and promoting health education, community connections, and making referrals. I think one of the coolest things is that we're gonna integrate some of our folks in the API community wanted to just get skills on a healthy eating and tools and resources. So I think that culturally we'll be able to do a lot of cool things and with the community health worker benefit and integrate behavioral health and health all together. Next slide. And I'll send it over to Bella to talk about the peer experience.
Awesome. Well, thanks, Rachel. Hey, everybody. My name's Bella. I am Painted Brain's peer workforce development coordinator. So I'm one of our peer support specialist peer trainers, and I also help support our graduates, peer training graduates, once they complete the program. So Rachel said so many things that I'm excited about and inspired about. So I might echo a couple of these things here. But as she said, Painted Brain, we are a Cal Mesa, so California Mental Health Services Authority. We are a Cal Mesa approved training entity for the curriculum of the Medi-Cal peer support specialists certified in California. So getting all these folks with lived experience to be able to get the certifications to do this work, we are one of the training vendors. So this curriculum covers the 17 core competencies as well as the code of ethics. Certified Medi-Cal peer support specialists provide recovery-oriented, culturally appropriate services that promote engagement, socialization, self-sufficiency, self-advocacy, natural supports, and are trauma aware. Painted Brains training activities include 80 hours of virtual instruction taught via our learning management system and Zoom. And we teach students or have graduates from counties all across California, which is one of the things I enjoy most about my role here at Painted Brain. So as a training vendor of Cal Mesa, we are part of Cal Mesa's effort to get as many folks with lived experience to be trained and certified as peer support specialists. So as of March 2025, Cal Mesa has certified over 5,000 Medi-Cal peer support specialists in California. And Painted Brain has put our big part in there. So from 2023 to 2025, Painted Brain trained 274 peers as approved training vendor and HCI peer personnel training and placement grant recipient. Our training program also supported 183 peers in retaining and obtaining new placement in behavioral health roles. So that's part of what myself and other folks on the team help do with folks after they graduate our program. It's helped connect them to roles that we have listed here. So being a peer advocate, a crisis outreach specialist, peer recovery specialist, a community health worker, a parent partner, of course, a peer support specialist, peer recovery specialist, and a case manager. So our mission here with our job training program at Painted Brain is to be able to provide folks with lived experience real jobs so that they can do real impact and help make real change both in their lives and in our communities. And to start to wrap out my slide here, I'm going to share a quick quote from one of our peer training graduates. Painted Brains program definitely made me feel prepared for the peer support workforce. I feel that the training really prepared me with the necessary tools and skills to be successful as a peer support specialist and feel more confident because of that. It really allows for everyone to feel empowered. And so that's what I'll kind of end on is that's absolutely one of my things that I want to help like emphasize here is not only the peer like empowerment component of this work, um, but the peer buy-in. So many peers that I get to work with really believe in this work, really benefit from the training, and are able to gain so much personal empowerment from this training, and then able to enact that good change into our communities. So um, before I pass it over to Rachel, in case any of y'all are interested, I'm just gonna drop in the copied over in caps, but drop in the peer support specialist code of ethics. And those are again things that just feel really great to be able to stand behind and really great for our peers to be able to relate to as their code of ethics in this work. So I'll pass it over back over to you, Rachel. Thank you.
Oh my God, you just dropped the jewel. I didn't even know you're gonna do that. That just does that makes me feel really empowered as a leader and a peer, as a person with lived experience. And I just we can go to the next slide because I think that just hones in on the next thing. And I'll say this, like, if people are still confused about what a peer is an individual with lived mental health experience or substance use challenges that utilizes that experience to support others. We are trained, certified. We go by a code of ethics. We have been integrating in the system for long before we were called peers. And we are rooted in supporting individuals with second chances, third chances to thrive. And we believe that we belong in healthcare, and we believe that we belong in behavioral health, and we believe that we can serve along with licensed professions and non-licensed professions. So the challenges, I think this is where I really wanted folks to lean in. I think we got like another question is like, we need to ask the system, do you believe recovery is possible? And then do we believe that recovery is possible and that the peer provision of service is an effective way to address the unmet needs in behavioral health care? Do you believe that? Do you believe that we should be working? Do you think that individuals with just as involved experience can, you know, serve their time, get rehabilitated in the hospitals? Like some of the people on the call right now that I'm serving with right now, the left state hospitals, left the criminal justice system, now thriving, full families, married, kids. We believe that. And we believe that they can work in healthcare. We can work in healthcare. So some of the stats here is just what it is. We got these stats a lot from Cal Voices, our friends. But this is true. So California employment rates for individuals with serious mental illness it significantly trails behind the national average, right? So we are trailing below. Like the reports show that our rate for employment among behavioral health consumers is 2.5% compared to the national average of 28.4%. We got a long way to go. California, we are leaders. We're the whole state, the world looks up to us. This says a lot of how we see individuals with lived experience working. In 2023, there are about 1.4 million adult mental health consumers who were unemployed in California. And as a commissioner, we hear, we vote on things, the governor and the legislators tasked us with coming up with solutions and innovations relative to addressing this very thing, the behavioral health shortage. We have a crisis with having a shortage of licensed professionals. I'm suffering right now as a leader of the company running an organization. We don't have enough practitioners.
Yeah.
Why not train peer professionals, CHWs, other allied professionals to come into the workforce, the behavioral health workforce, in managed care, in behavioral health care, and let us work. There's also persistent stigma, even among, like, as somebody that I teach this, so right, I teach about biases. Our social work interns and a lot of our interns get a training on bias. I also got a training on bias for CARE Act too, if you want to look at that video. Stigma relative to a mental health illness and going to jail. And I say there's a little bit of rifles because but the stigma is real. And it's way too much. Like, it really stops people's beliefs and really contracting with us, even though we're recovered. We say we're recovered, we went through the system. But I think we need to ask ourselves, like, do we have biases of people with criminal backgrounds? Do we have biases amongst our family members that are a little different? Or people with mental illness, the people on the street that are disheveled? Those are the questions. So we have limited inclusion. So I told you earlier, we were not able to, since we were so small and we're peer-led, we were typically shut out of the contracting process initially to even get path-cited money, to get in front of the health plans, to get in front of the hubs, to get in front of anybody. And we were thankfully so that we got a waiver to apply for capacity building because we didn't have any engagement with the health plan. And we were able to get some capacity building to help us build out the services. But essentially, we were unique and we had cash reserves. That's unlike other organizations. So, and we're still struggling right now to meet those needs. So the contracting process is extremely difficult to get into. Even though we have the capacity, I think that we should challenge the system, behavioral health, county behavioral health, and managed care plans with rethinking their contracting process, still putting us through the rigor. I think I like doing the work and making sure things are legit, but I think that there could be opportunities for smaller CBOs to really be able to do this great work that we're doing if you would give us a chance. Painted Brain on record. We've passed our 23 audit. We're in the 2024 audit, clean audits. We can pass audits. We can get insurance. We have EHRs. Peers with lived experience and criminal justice backgrounds can work. We can run businesses. We can manage the books. So hopefully we reduce some stigma around that. Next slide. And then we really just want to briefly go over more because I just want to keep telling you the power of the peer. People like us are at the state level right now. We have a contract with 7 counties to train hospitals, law enforcement, crisis response teams, and county behavioral health professionals on advanced care directives, specifically psychiatric advanced care directives. And those are directives that express a patient's wishes during a time of crisis. Peers are working, as we noted, with hospitals right now to train them on the current laws. There's current laws right now that require for hospitals to ask people about advanced directives. What we're doing now, we've also, with the technology company, built a digital registry that we hope that's being tested in 7 counties. We hope to work with hospitals and law enforcement to increase psychiatric advanced directives because, like we said, we know best what works for us. What beautiful what day would it be that the patient and the hospital and the practitioner work in harmony to do care plans. And that's what our vision at Painted Brain is to do for our whole great state of California and with our county partners. And we only wanted to mention that because I just want to continue to demonstrate the power of the peer support specialists in healthcare and how we're advancing, supporting people with agency to help with their treatment planning, because we all believe recovery is possible. Next slide. And then we're almost done. Our call to action. Our call to action is we really hope, and we're calling out to legislators. There were bills that we're working on, but we really want, and our hope is to call to action to integrate peer professional and the peer service provision and managed care. If you don't leave with anything else, we want to serve managed care, Medi-Cal populations utilizing our provision of care. And we believe that we must eliminate barriers to entry to that for peer-run organizations, small CBOs like us that can do the work. We can do the work. We want to eliminate these barriers in accessing technical assistance to build the capacity and infrastructure to provide Medi-Cal services for small CBOs. There's a lot of people that did get help, but I don't see a lot of the small CBOs that got the technical assistance. And like I said, they definitely wouldn't have all the cash reserves because now our whole system is moving to Medi-Cal. There's not many more grants and stuff is drying up. The MHSA is drying up relative to some community support. So we need to contract with the plans and we need technical assistance so that we can sustain our provision of service unless it's going to go away. We want to eliminate barriers for CBOs and peer-run organizations to engage with county contracting and healthcare managed care plans. We have faced significant barriers. As a commissioner, I get calls and emails from CBOs that are saying, we don't know what's going to happen to us after the MHSA is done. No managed care plans even know who we are or what we're doing. Like, how do we get help? I hope that this speech at least gives you guys an idea of our power and what we can do. And we want to eliminate barriers by building a network for intentional and coordinated strategic partnerships and referrals. We want to communicate. We want to be a network. We want to get in. We want a seat at the table. We can serve. We are in schools. We're in continuation schools right now that need ECM, that need right now. They're not getting any help. We need to get the plans. So and how Painted Brain is addressing those barriers, we already know that we're a community-defined, person-centered. We're providing care coordination with an integrated model that unites certified peer support specialists and full behavioral health professionals. In Painted Brain, we're building a community network for Medi-Cal benefit services and referrals currently in Los Angeles County, San Bernardino County, Alameda County, and beyond to uplift the lived experience and expand our service model and build a referral pathway for clients to support clients. And I think I talked so much. I tried to, I don't know, but I hope that you left this this webinar with having a greater understanding of the peer model, having a greater understanding of how our painted path of the recovery with integrating arts, advocacy, and behavioral health and mental health support and enterprise supports the whole health of the individual. And I hope that if you're a health plan on this call, that you consider contracting with a peer-run organization, or if you're a hub, please allow other peer-run organizations or small CBOs if they have the capacity to do it. I think that's it. I don't know if Bella has anything else to add before Marie, and I know we're on the time too.
This is great. Thank you so much. And maybe we'll take the slides down, just open it up for Q&A for folks. Please join me in thanking Bella and Rochelle for spending this hour with us and sharing information about Painted Brain in the last 40 minutes together. So I want to just uplift one of the questions that came up in the chat and appreciate the conversation that's happening as well. But just want to ask Rachel and Bella, what advice do you have for organizations who are interested in working with peer support specialists, whether they're interested in hiring peer support specialists, developing a program within their organization, partnering with a peer support organization? Are there any either resources or just advice you have for folks on the call?
I think if you are an employer, I think it's important for you to have certified or just train staff in the ADI. They don't have 80-hour training, the Medi-Cal peer support specialist training. It's important to have a supervision protocol for peer support specialists, because I believe it's definitely a unique provision of supervision, just like clinical supervision, which we run at our company too. So I think that we really encourage folks to there's a 2-hour or 1-hour supervision training at Cal Mesa website that will support employers on that. I think the biggest thing is to note that peers are employees just like your clinicians. Like I always say this, I've been developing clinical programs and doing this for over 20 years. I know I don't look that old, and I've been running a program in clinical work. I've dedicated the last 15 years in building out the whole continuum of care. So I think that it's not them and they, or, it's your whole team. And so I think that that's a big point. And to have the same standards and boundaries and training protocol for them. I mean, as an organization, hiring a peer-run organization, I think the same standards is ensuring that, they meet the threshold that they have, if the county or your plan requires an audit, that, that they have those same things. I think that we want to just have an opportunity. I think even, and I think that there is unique things about hiring individuals with criminal backgrounds. So I think that the biggest thing is to follow the law. As a California employer, since I am, I think that the law, requires that, you give, each individual, every record that shows up something, that it's an individual case, and people should have a right to be able to discuss and talk about rehabilitation and talk about, that. I think that's one of the most beautiful things, just to be an employer. And yeah, I mean, I want to encourage, another piece is just encourage people that it's the same. I mean, I have the same challenges as I have with any employees. So I think if you're worried about, people being a certain way, I think that it's just how you, set up your organization, being trauma informed. I wouldn't say, I want every peer professional that works in an organization to be at an organization that's trauma informed. You know what I'm saying? That's, anti-racist, that uplifts and have pathways for what is that? For promotion, that peers aren't just like, when my job, and I'll say the last thing, when I did when I asked for a raise years ago, I asked other peer one organization for a job description. And now I tell all the peers at my organization, because I'm succession planning. I hope for it's the job is to have someone else do it. But I looked at a job, I used my comp for a job description for a peer organization with a high school diploma, a peer support specialist, and it was 6 figures. So I think that so I think that there's pathways for us to run organizations. And I think if your organization, if you want to pigeonhole us to just that role, I think it wouldn't be good. I think that we can be leaders, we can run companies, we can run agencies, we can do anything.
Thank
I
you,
don't know if
Rachel.
that answered that.
Yeah, I'm curious, Bella, and then I'll get to I'll call on you, Kelly. But Bella, just want to offer if there's anything you would add to what Rachel shared, especially because you do the workforce develop, you're in, really close to peer professionals. So just want to give you a chance to share if you have anything to add.
Yeah, thank you, Marie. No, I think Rachel hit on a lot of what I was going to speak to. I think, I would kind of like call out and ask if your employer like guidelines or however you screen folks, if maybe how you screen folks traditionally had looked into different things or valued things in different ways, maybe kind of challenging you in your organization to almost like give peers the opportunity. Um, the other thing I would add is that if you are an organization, hopefully already incorporating peers and peer-led like work in at your agency, I would encourage you to really actually give peers a seat at the table in terms of like actual like middle management meetings, opportunities to really like have agency in designing or thinking about how processes work. So it's sort of this thing of like like Rachel was saying, like we have to actually check some of our biases to think about like, do we actually see peers as equal collaborators and colleagues, or is there still some sort of like, asymmetry going on? But that's just what I wanted to add. So thank you.
Thank you, Bella. Kelly, I'll invite you to introduce yourself and ask your question.
Thank you. Hi, my name is Kelly O'Connor. I'm the Executive Director of Maternal Mental Health Now, and my pronouns are she, her. Hi, Rochelle. We've connected in the past, and in fact, two of my colleagues have been through Painted Brains Medi-Cal Certified Peer Specialist training. And I reiterate what you said about the supervision piece. That's something we introduced a little bit after the fact and was hugely important and beneficial to their work. But my question for you is regarding like financial sustainability and Medi-Cal reimbursement. And so I just want to kind of summarize what I heard you say. That my understanding is that there's three main ways to sort of pay for peer support services. There's Medi-Cal direct Medi-Cal billing for peer support. There's CalAIM, so enhanced care management, and then there's county contracts. Is that correct? And my question is, which of those do you feel is most return on investment or most lucrative, for lack of a better word?
So okay. So I want to clarify. So the pathways are county behavioral health plans that currently we are only in as the certified Medi-Cal peer support specialist. I don't currently know of any organizations in our state that have like peer run organizations that have a contract. So that is already an opportunity, I guess. I know that other counties are drawing down the benefit, like Nevada County and other people are beginning to, but I don't know of any peer run organizations. So I don't want to feed you like a false sense of hope, but I don't know anyone. We're not, and I don't know anyone, but I think there's hopes. And then for managed care plans through CalAIM and community health worker benefit, peers are operating, a significant number of peers are operating as the CHW or as a lead in another, like as a lead. Our peers are on our ECM team are operating as lead care managers under the clinical supervision. Like we have 2 clinical staff. But I think so the lucrative part, I think and I talked to a lot of organizations across the state. If you didn't have the path cited money, like which we did not, like you either needed a ton of cash to start. I mean, it's a large amount of money we've even spent, and we have to slow down until we get our other contracts because we haven't executed certain contracts. So if you don't have a ton of cash to make the investment, then and the path cited is in its last round. So I can't speak for the government. I don't know of any other ways besides you having now is either going to a plan directly and being like, you have money. I mean, you have a team ready to go. Like we have a team ready to go because we're trying to go to the plans right now. Like, please hire us right now. Like, because we have a team, but I'm not going to have the team forever. I'm not going to be able to sustain it. And we did apply for PAF cited, but PAF cited won't come in if we get it, and hopefully we get it, because then that will be a problem. But that wouldn't come in until December. So to get back paid on that. So I think I don't know, not to be daunting. I think like, that's why I said, like, when we changed the law around Medi-Cal and with Prop 1, and, I think there's a lot of great opportunities. I just think that there was going to be barriers for people that were small CBOs that couldn't get in front of those health plans to get a letter to get the PAF site. It took me 2 years to even be ready to apply for PAF site because I couldn't get in front of no health plans. Like you needed a letter to apply for that. So, and you needed a letter to even get TA, and we had no health plan. So we had to get a waiver through DHS, and DHS was like, you've been doing this, we don't understand. And other people said they didn't understand. So I'm not trying to be completely daunting. I just, if you want to talk offline, but I want to be honest. I mean, it's my duty as an officer of the state to be honest to you, and as a practitioner, of the healing arts. Yeah, this is why the big guys and gals have been able to do it, because it's a lot of money, and I'm smiling right now. Open. Yeah.
What's the difference between the county managed care plan and in LA County? I know the main managed care plans are LA Care, HealthNet, Molina, etc.
So so the commission, like, so there's county behavioral health plans. They serve our most like severe and persistent mental illness Medicaid population. Then there's the commercial managed care plans that serve mild to moderate. But then they go in between. Like that's what hopefully that what the Prop 1, the positives is that people are talking in the plans. The counties are going to work more with the managed care plans because people go in and out of those, and sometimes the county gets stuck with different things. So yeah, I can talk more about, I can go very much in detail, but a lot of this information wasn't just handed out to us. It took a long time for us to figure it out. So it's still like the little guys sometimes get, we're straggling at the end, like, there's a last round of this money for this, and I hear there's no more. So yeah, I know there's more hands, and I want to, Kelly, if you want to reach out again, I can talk more. We can leave my email is not the best, but maybe Bella's or somebody else that we can, so I can get back immediately on this. Yeah, Marie, did you?
Yes, we have time for one, maybe two more questions. So is it Miran?
Miron.
Miran. Okay,
Hi.
I will welcome you to introduce yourself and ask your question.
Thank you. I don't have a question, I have a comment. My name is Miron. I'm with Cal Voices. Rachel, thank you for your brilliant presentation. We appreciate. I just want to say that despite the proven value of peer support services and the critical role of PSS in addressing behavioral health needs statewide, California has not fully integrated the 6,798 certified medical support specialists into the medical managed care plan program. Painted Brain has been a reliable partner with Cal Voices in advancing legislation to include peer support services as a medical benefit program rather than the county opt-in program. We would love to work with the CIN and other partners to push for legislation to make peer support services a medical benefit, finally. We have a bill proposal, and we'd love to share it with CIN to explore how we can work together. And we hope this important policy issue gets the attention it deserves. And thank you, Rachel, again.
Thank you.
Yeah.
I see more hands are up, and I just want to uplift some of the questions that were in the chat. I think we can get to one more. So, Crystal, if you want to put your question in the chat, that way we can capture it. But so I just want to mention Arlene from Inland Empire Health Plan asked, how would you recommend approaching teams and inquiring about the required criteria of lived experiences without violating privacy issues or other HR policies? Is there thinking about the peer certification program in some of their existing teams?
Well, I'd love to take that question offline, but I think if you're hiring the position, if the position is designated as a peer support specialist, or even a CHW has a I don't know, like I think it's lived experience, and I think in a different thing, but I think if you have those roles, the expectation, because we're trained to utilize our story and to utilize that in the provision of service. So it's not like I don't ever really, when we are interviewing someone, like I think that we don't say, do you, and not that you said this, but I'm saying we don't say, do you have a mental illness, or do you have like, they're like, a peer is the person with lived experience and went through, trauma, and, or other things. Do you identify as a peer? Like, I think that would be like, you can give a description of the role. But I think, and I follow the law since I'm an employer, I think the job descriptions are important. I think that if you are going to move someone into a lived experience role, and I think that people shouldn't be working outside completely of their scope. So, I mean, and I'm not saying you said this, but a case manager shouldn't be working as a peer.
I have something to say. I'm just sitting right by Rachel. Hi, my name's Bettina. I'm with Pain and Brain. One thing about our job description, when we are hiring peer support specialists, in our qualifications, we do ask that somebody is a certified peer support specialist or is in the process of getting certified. So, as with any other position where you are asking for, licensure qualifications, this is one that is recognized by Medi-Cal. And so I think that is probably the indicator that you're looking for when you want to hire a peer.
Thank you. So always follow the law. Put it in your job descriptions. And then take the training on the supervision training. And we're gonna probably push out a supervision training, a longer one, but there is a 1 hour one for Cal Mesa. Was there any other questions? I appreciate you, Bettina, for answering that.
Yeah, I think we're gonna wrap up because we're right at time. I am gonna launch the poll with some feedback from all of you. We're asking for your feedback, but really, I hope you all can just take a moment to join me in thanking Bella and Rachel for being with us today and sharing the amazing work that they're doing. We will be following up in a post-webinar email, sharing this recording and hopefully keeping the discussion going. So thank you all so much for being here today, and look forward to seeing some of you on future CIN webinars. Thanks, everyone.
Bye, thank you.
It's beautiful work. Thanks, Rachel and Bella.